This 10-minute tutorial will review common medications used to treat heart failure, followed by 5 multiple-choice practice questions. In this lecture, we are going to review cardiac medications which may be used for heart failure and also other cardiac conditions like hypertension or arrhythmias. Drug categories that will be reviewed are diuretics, beta blockers, angiotensin receptor blockers, angiotensin-converting enzyme inhibitors, and cardiac glycosides. The first category of diuretic are the loop diuretics, which are the most rapid-acting of the diuretics. Loop diuretics have imide as a suffix in their name, for example, furosemide. They work by blocking reabsorption of water in the loop of Henle within the nephron. Most common adverse effects are hypokalemia, or low potassium, hypovolemia, which is low blood pressure, ototoxicity, and nephrotoxicity. Therefore, patients with pre-existing hearing impairment or kidney disease should receive this drug cautiously or not at all. The thiazide diuretics are a stable diuretic category with moderate onset of action and optimal efficiency, making it one of the most common diuretics used. Thiazide will be in the drug name, for example, hydrochlorothiazide. Thiazide diuretics block water reabsorption in the distal tubule of the nephron. Common adverse effects include hypokalemia, increased production of uric acid, and elevated calcium. Thiazide should be used cautiously in patients with low potassium or a diagnosis of gout. Thiazides have a sulfa group in the molecular structure. Therefore, if a patient has a history of severe sulfa allergy, thiazides should be avoided. Next are the potassium-sparing diuretics, otherwise known as aldosterone antagonists. The most common drug in this category is spironolactone. This diuretic category works by inhibiting aldosterone, leading to sodium loss in the nephron, causing water to follow and be excreted. Adverse effects include hyperkalemia, therefore caution should be given when a patient has an elevated potassium at baseline. Spironolactone also acts as an androgen-blocking agent, blocking effects of testosterone, which causes estrogen effects to be expressed like breast development and higher-pitched voice. Beta blockers can be identified if the drug name has a suffix of OL-OL. If the first letter of the drug name begins with the letters between A through N, it is a beta-1 blocker, and if the first letter starts with a letter between O through Z, it is a beta-2 blocker. Beta blockers work by blocking adrenergic effects of the beta receptors. When adrenergic receptors are blocked, a cholinergic response is expected. Blocking beta-1 receptors results in a decrease in heart rate and blood pressure, and blocking beta-2 receptors can lead to bronchoconstriction. Therefore, beta blockers are generally contraindicated in patients with chronic respiratory conditions. If a patient's heart rate is less than 60 beats per minute, the medication may need to be held because beta blockers can compound the effect, dropping the heart rate even lower. Beta blockers can disguise symptoms that diabetic patients experience, for example, jittery feelings associated with hypoglycemia. Therefore, extreme caution should be given when using beta blockers. First, let's review the renin-angiotensin-aldosterone system, which angiotensin drugs primarily target. This system is activated when the kidneys detect decreased blood flow associated with low blood pressure. First, the juxtaglomerular cells of the kidney convert the substance pre-renin to renin, and the liver releases angiotensinogen. The renin produced by the juxtaglomerular cells of the kidney converts angiotensinogen to angiotensin 1. Angiotensin-converting enzyme converts angiotensin 1 to angiotensin 2. Angiotensin 2 stimulates aldosterone, an antidiuretic hormone. This leads to reabsorption of sodium with water following within the nephron unit. Blood pressure is regulated through water that is retained secondary to sodium reabsorption in the nephron, and also through direct vasoconstrictive effects that angiotensin 2 has on smooth muscle of the blood vessels throughout the cardiovascular system. Angiotensin-converting enzyme inhibitors are a common drug used in a variety of cardiovascular diseases. Pril is the common suffix to this category, for example, lisinopril. ACE inhibitors prevent angiotensin-converting enzyme from converting angiotensin 1 to angiotensin 2. The absence of angiotensin 2 prevents water reabsorption and vasoconstriction from occurring, which lowers cardiac workload and blood pressure. Adverse effects include high potassium or hyperkalemia, angioedema, and a dry cough. If the patient develops angioedema or persistent dry cough, alternative drugs should be considered. Potassium levels should be consistently monitored, especially when using other drugs like diuretics, which can cause fluctuations of potassium. Angiotensin receptor blockers are another drug category which affect the function of angiotensin II. The common suffix is sartan, for example, losartan. These drugs work by preventing angiotensin II from binding to receptor sites, which again prevents water reabsorption and vasoconstriction. Like the ACE inhibitors, adverse effects can include elevated potassium and angioedema. Monitoring of potassium levels and attention to other drugs with similar side effects should be a priority. The last category are the cardiac glycosides in the well-known drug digoxin. DIG is a common prefix of this group. By blocking sodium-potassium pumps, the cellular charge is altered due to remaining calcium ions, which leads to a more powerful contraction with each heartbeat. Before taking digoxin, the patient's heart rate must be measured, and if less than 60 beats per minute, the dose may be held. This avoids compounding one of the common adverse effects associated with this drug, which is bradycardia. Digoxin toxicity can manifest as symptoms of anorexia, visual disturbances, or chest palpitations. Adverse effects can be compounded if digoxin is taken with a loop or thiazide diuretic. Serum digoxin levels can be monitored, and a normal range is 0.5 to 2 nanograms per milliliter. If the patient is symptomatic and levels exceed the normal range, the antidote Digibind Immune Fab can be given to minimize additional toxic effects. Now let's test your knowledge with some practice questions. You'll have 5 multiple choice questions with 10 seconds to choose your answers. If you need longer than 10 seconds, just pause the video after the question is read. Good luck! Which of the following drugs may cause hypokalemia? Select all that apply. Torsemide, hydrochlorothiazide, spironolactone, digoxin. Torsemide and hydrochlorothiazide are diuretics that cause lower serum potassium due to increased potassium excretion in the kidneys. When entering the circulation, digoxin binds to sodium-potassium pumps, which can also decrease or increase circulating potassium levels. ACE inhibitors result in which of the following outcomes? Select all that apply. Vasodilation, vasoconstriction, ADH is inhibited, ADH is released, increased urination, decreased urination. By inhibiting angiotensin-converting enzyme, a decreased production of angiotensin II leads to symptoms of vasodilation, decreased release of antidiuretic hormone, and increased urination. These effects are beneficial for patients with cardiac conditions where cardiac output needs to be therapeutically reduced. After starting a new drug for heart failure, the patient develops a harsh, dry cough. Which drug category would be most likely to cause this reaction? Beta blockers, diuretics, ACE inhibitors, angiotensin receptor blockers. The inflammatory mediator bradykinin is regulated in various ways, one being angiotensin-converting enzyme. When this enzyme is inhibited, bradykinin production increases, causing an inflammatory response with dry cough as a common symptom. Angiotensin receptor blockers do not interfere with this enzyme, thus bradykinin is not affected with this drug category. One of the first signs of digoxin toxicity is anorexia, bradycardia, arrhythmia, visual disturbances. While all of these are possible symptoms of digoxin toxicity, anorexia, or loss of appetite, is commonly one of the first symptoms a patient will notice. Which medication may hide symptoms of hypoglycemia in a patient with type 1 diabetes mellitus? Loop diuretics, aldosterone antagonists, beta blockers, or cardiac glycosides? Beta blockers have the potential to mask symptoms of hypoglycemia. Therefore, patients with diabetes should avoid beta blockers if possible. That wraps up our tutorial about common medications used for heart failure. We hope you found this helpful in your learning journey.